The midwives, doctors and support workers are there to support you during your hospital experience. Asking for their help may occur when they come round to see you, or it may be that you need to ask for something using the buzzer. If you are waiting to speak with a doctor, please be aware that sometimes this can take a number of hours, dependent upon how busy they are. If things change and you start to feel worse, or you develop new symptoms, if you develop new pains or your pain worsens, for example, you should let someone know immediately. Potentially also, you would want to let somebody know if your baby's movements were concerning you, or any dizziness, just anything at all that you feel doesn't feel quite right, and is that a new symptom that you're concerned about. Maternity wards often are really busy places. It might be that you've asked for something and it just doesn't come straight away. Please do not be afraid to buzz that communication buzzer again. It is far better than you sitting waiting, wondering if the person has forgotten about you or not. Your needs as an autistic person may sometimes differ from those neurotypical needs. It's important that you do ask for help with things, rather than just struggling feeling like you shouldn't ask. You have an absolute right to reasonable adjustments to be made to support you with any communication, interaction and sensory needs, for example, just anything at all that will make things easier and help you to feel calmer and more regulated. If you find asking for help is difficult, now is the time to think about what could happen that might make that easier for you. For example, if you know when you're anxious, you have a tendency to shut down and struggle with verbal communication, would some communication cards help you at that time? The cards you could prepare might be things like, I am in pain, I would like pain relief please. Please can you tell me the plan? Can you help me to feed my baby? Please can you check my pad? Please can you check my baby's nappy? Or would you find it easier to text these at the time, or to ask your preferred communication partner to help you and to ask for you? There sometimes can be a delay in answering the buzzers when the ward activity is very high. If this happens and you need help faster, you can always go to the nurse's station to find someone, or ask your partner to do this. In a situation that you're concerned might be an emergency situation, it is always safer to pull the emergency buzzer that you should have located in your room by your bedside. Always pull it, even if you're not sure if it's an emergency. If you're concerned that it is, they would much prefer to come. That will always make sure that you get lots of people in the room quite quickly. If you ever did need to pull an emergency buzzer, please be aware, like I've said, that there will be a lot of people very quickly in the room because they want to assess the situation and see what is happening during the emergency. Staff would always prefer you to ask for help rather than struggle. For example, after a cesarean section, you might struggle just to pick up and put your baby down from the cot, so it's absolutely fine and totally acceptable to buzz for help with doing this. Please talk with your midwife about what you might find difficult when asking for support, so that in your care plan, staff can consider what they should be doing to make this easier for you.